maybe this is a good time for me to geek out on the internal medicine side a little bit. Because the reality is I don't really see most of these infections are treated by primary care or in the emerge. They go home, they're not admitted. But there's a gonorrhea especially, it can have this really weird, big presentation like Kool-Aid Man Plus or Kool-Aid Man Brings a Friend, where it affects
Kool-Aid
different
Man
parts
is
of the body.
steroid.
Yeah. We have, like, honestly, guys, we have so much art here. We could just throw it into AI and get some good pictures. Although it starts in the urethra or down that area, but it can actually disseminate. It can go to the rest of the body. And what we see is you can get joint swelling sometimes. So you can actually get gonorrhea infections in a joint or 2 joints or 3 joints. Usually it's a small amount. You can get it in the eyes. So something we call conjunctivitis, inflammation of the conjunctiva of the eye. And you can get skin changes as well. And then you can get inflammation of the tendons. So once it kind of gets into the blood, it can spread to all these places. The eye can also be direct contact. And it can be very pronounced, very painful. Oftentimes you do need admission if it's to this. On the chlamydia side, it doesn't really do that. The only thing chlamydia can do is you can get joint swelling, which is the chlamydia is not actually in the joint. The body just gets confused. And when it tries to fight chlamydia, it also attacks one of its own joints. That's called a reactive arthritis. It's usually not as pronounced. So yeah, gonorrhea, like in my world, when someone comes in with joint pain, it can be 1,000 things, but gonorrhea is always top of our mind.